My name is Morton Bertram. I'm an orthopedic surgeon in Naples, Florida, and I've been doing orthopedic surgery for about 30 years. My specialty is joint replacement surgery. I do specifically hip and knee replacement surgery. And for many years I've been interested in nutrition for my patients, even as far as 25 years ago. There's been more literature recently about the concept of patient optimization and making sure that patients are screened properly and that they're properly nourished prior to surgery. We've had quite a bit of enthusiasm for this particular topic over the last several years. We will do things preoperatively for our patients, like we will screen them with particular laboratory studies, which include things like zinc and vitamin D, as well as albumin. Of course, we check their blood sugar and CBC and basic labs. It's been amazing to me that over the years of doing this, we've just learned recently how important things like a vitamin D and a zinc level are in terms of patients' risk for infection. For instance, it's shocking but true that approximately 40% of our patients are vitamin D deficient, sometimes significantly deficient. I would say at this point probably 25 to 30% of our patients are also zinc deficient. Now, the reason this is important is because vitamin D and zinc deficiency have been proven to increase our patients' risk for infection post-operatively. We also use a probiotic prior to surgery. We've been doing that for many years, and that's helped patients avoid C. difficile infections after surgery, and probiotics are also helpful for immune health. So before the surgeries, we would make a shopping list for the patients for years, and we would say, we'd like for you to get this particular product or that particular product, which included things like vitamin D and zinc, protein supplements, probiotics, and we would have them get all these different products at all these different places. But over the last 6 months or so, I've become aware of a product called PowerOp, made by a company called Nutritional. And this is an amazing product, and it's been well researched and has very high quality products. So fortunately, I have this product now available, and I can have my patients take this one product, and it has all of the things in it that I wanted to give them with their shopping list. So instead of me having to have them traipse around to different pharmacies or drugstores to get all these different products, we have this product available now that's in one canister. And we'd like for the patients to take it 4 weeks before surgery and then 2 weeks after surgery. And in doing so, I can now be assured that they have a high quality product, they have a very high quality protein, that probiotics are blended in there, they have vitamins, amino acids, nucleotides, and things that they need to avoid postoperative complications. It's been proven from the literature that patients that are better nourished preoperatively have a lower risk of infection, have a lower readmission rate, have less pain, have a lower readmission rate, they have decreased complications in general. So the patients will be very pleased to know that they can obtain this product, and it should definitely improve their outcomes. And I think that we will be able to prove that in the near future, as we have a study we're doing very shortly.